Well, good morning, everyone. This is your 2020 open enrollment presentation for the City of Dallas benefits. So everything that we walk through today, all of those benefits will be available to you beginning January 1st. So anything you sign up for will become effective January 1st. You'll just need to make sure that you complete your enrollment. And before we get into the presentation, this is an active enrollment. So you will all be required to make some sort of action involving your benefits if you want to have City of Dallas benefits in 2020. So the open enrollment officially begins today, September 16th, and it will run through October 4th. Again, if you want to have benefits, you have to take advantage of this open enrollment period. You will have 3 ways to enroll this year. So you'll be able to enroll online, you will be able to enroll by the phone, or with an on-site enroller. And there are on-site enrollers who will be stationed at this location for the duration of the open enrollment period. So if you don't take advantage of an on-site enroller today, just know that they'll be here for the next 3 weeks. This is the only time of year that you will be allowed to make a change for 2020 benefits unless you experience some sort of qualifying event. A qualifying life event would be birth of a new child, adoption, divorce, marriage. Those are all reasons that you will be allowed to change your benefits for during the upcoming plan year. So if you don't make an election during the annual enrollment period, you will not have coverage in 2020. But if you enroll during the enrollment period, that coverage becomes effective January 1st and remains in place for the balance of 2020. So how do you enroll? New this year is your opportunity for an in-person, what we're calling an in-person enrollment with a live benefits specialist. There is a calendar that you can view on the city's website that shows you where there are benefit enrollers posted throughout the city for this full open enrollment period. So there's several opportunities if you want to enroll in person. You can also enroll online. This information, including this presentation, is also posted on the city's website, so you don't need to write it down. They also have it here on this insert that you were distributed. You will be required to use a PIN and a login to access the system. The login for this year, and this is new, in previous years I think you've used like an employee ID number, so we're changing it for this year. In order to log in online and to make your enrollment, you'll log in with your new username. The username is your first name, your last name, and then the last 4 digits of your birth year. So again, first name, last name, and then the 4 digits of the year. Make sure to use the full year. So if it's 1975, you need to use 1975. The PIN is 6 digits, and it's the last 4 digits of your social security number and the last 2 digits of your birth year. You will also be required to change that PIN when you first log in. So you'll get a prompt that says you've successfully logged in, now create a new PIN. So you can enroll in person, you can enroll online, and you can also call in and speak with a benefits specialist. The phone number for the specialist is also posted within your guide, as well as on the insert you've received. The hours to call in and speak with a benefits specialist are Monday through Friday from 8 a.m. to 5:15 p.m. Central Time. So what do you need to enroll? First, you'll need to have make sure you pull your supporting documentation together. And you'll only need supporting documentation if you are adding a new dependent. So if this is your first time adding a child or a spouse to the plan, you will need to produce supporting documentation, so marriage certificate, birth certificate. If you are not changing the dependents covered under your plan, then you'll be fine to proceed with enrollment. If you have questions around what you need or just general questions about the benefits, this year, please make sure you're using the benefits specialist to support you during that time with any questions at all that you may have. So what's new for 2020? Well, let's start with cost, because that's probably the most important thing for most of us. So the HRA and the HSA medical plans have no change to your coverage costs. This year, in 2019, we introduced a new copay plan. You'll still have a copay plan option in 2020, but that plan has been enhanced, and we will now refer to it as your premium copay plan. So the premium copay plan only has salary bands attached to it for 2020. So if you earn less than $66,000 per year, then your coverage will decrease if you are currently enrolled in the copay plan today. If you earn more than $66,000 per year, the copay plan rate stays exactly the same. So this is good news, and I'll just say that one more time because I saw some folks are confused. So there's salary bands, and as you look at those salary bands, look at where your annual earnings are. If you earned less than $66,000 last year, then that copay plan will be available to you at a decreased rate. If you earned more than $66,000 last year, the rate stays the same. Okay? Also new this year, and as a reminder for you, is that HRA plan, and the HRA plan today is the plan where you get a contribution from the city into your health reimbursement account. That plan will expire at the end of next year. So in 2021, the HRA plan will no longer be a plan option for the City of Dallas employees. The ER copay, which is emergency room copay, that coinsurance and deductible will still apply. And the HRA contribution amounts are changing. So if you're in the HRA plan today, just pay attention as we go through this PowerPoint, because the city's contribution to that HRA plan will change to $200 for individual coverage, so if you're covering just yourself. But if you have any dependent level coverage, so employee plus spouse or employee plus family, that HRA contribution for 2020 will now be $700. So what else is new for 2020? So we talked about the premium copay plan, and remember, the premium copay plan is the same copay plan as you have available to you today. It has just been significantly enhanced. First and foremost, you now have a new lower urgent care copay. So the copay on the urgent care copay will now be $40. There's also a new ER copay of $300, and this is different because on the current plan you have your copay and coinsurance. Going forward, you'll have your just a copay for that ER exam. And then you'll also have a lower calendar year deductible. The current deductible on the copay plan is $2,000 for an individual, so those deductibles are decreasing. So it'll be a $1,500 deductible for an individual, $3,000 deductible for family. So this is a huge positive for that premium copay plan. Lab and X-ray services will be covered at 20% after your deductible is met. If you have services performed in your doctor's office, so you go to your doctor's office, and while there he says, take this form, go, stay in my office, go around the corner and get your lab and X-ray done. Those things are covered still under your office visit copay. But if you get a lab visit that says, take this form, go down the hall, around the corner, or to the building 5 miles down the road and get lab work done, then those are things that will apply to your coinsurance. Another enhancement for the premium copay plan is we are removing the separate pharmacy deductible. So today there is a $700 deductible that sits on the pharmacy plan for the premium copay plan. So you hit the pharmacy deductible first, and then you go into coinsurance. With the new premium copay plan, there are copays for prescriptions. Those copays are $15 for generic, $40 for preferred, and $75 for non-preferred. So this is a big change to that premium copay plan, and we are excited to be able to introduce a copay option for pharmacy to the City of Dallas employees. The other change around medical is that the HSA deductible is increasing. We'll talk about that in a little bit, but also the contribution amount from the city is increasing. So starting in 2020, if you take the high deductible health plan with the HSA attached, the city will contribute $700 if you have individual coverage, and then $1,700 if you have family coverage. So this is also a huge enhancement for those of you who are interested in taking the high deductible health plan with the HSA attached.
Is employee plus children considered family?
It is. Absolutely. Any dependent level of coverage is considered family. Other things that are new for 2020, your flexible spending accounts, those FSAs, both your dependent care flexible spending account and your healthcare flexible spending account will now be provided, CIGNA will be the administrator for those services. So you will have a joint debit card for your medical FSA account, your limited purpose FSA account, and your HRA. There'll be no debit card for dependent FSA expenses. So if you are participating in the dependent FSA account, you can file those requests for reimbursements online, but there will be no debit card assigned to it. Dental, vision, life insurance, all of those plans have no changes for this year, so there are no plan design changes to the plan. The dental PPO premiums, there is a slight increase on the PPO plan premiums, and we'll show those later in the PowerPoint. The big news for 2020 is voluntary benefits. Some of you have reached out to the city on a number of occasions asking when you would have an opportunity to participate in the voluntary programs. Voluntary programs are things like critical illness, hospital indemnity. You have a cancer plan today. So the city has selected a new vendor. That vendor is the Standard. The Standard will be the plan administrator for all voluntary benefit products. So today, if you have voluntary products, you may have policies with 3 or 4 different carriers. Starting next year, any voluntary benefits that you elect will all be under the Standard. I'd say please pay attention to the benefit guides which have been mailed to your home to review those policies and to review those plan offerings. All of them have been significantly enhanced, and the majority of them are now available to you at a much lower rate than what you're paying today. So I would say take some time, be sure to talk to the enrollers about the voluntary benefit options, because there may be some of you who are not participating in those plans today because it's cost prohibiting. But I think if you look at the new benefit offerings, you'll find that in addition to those benefits being enhanced, they are also much, much more affordable to you. The last note here is in reference to universal life. Some of you today have a universal life policy. Those policies will no longer be continued in terms of deducting them from your paycheck. So if you want to keep the policy in place, you can do so, but you have to work through that vendor and keep it outside of payroll deduction. You will have the option to add additional life insurance through the Standard, and those policy amounts can be deducted from your paycheck amount. So you don't have to continue any voluntary products that you have today through direct bill. You can take the new voluntary products offered by the Standard, and then all of those new policies will be payroll deducted. Okay. So what else is new in 2020? We've simplified the wellness program. Some of the feedback that we've received around the wellness plan is that there are too many steps for us to complete. We can't get everything done, and therefore we are not receiving the wellness incentive because there's too many things for us to do. So for the 2020 wellness requirement, which the date and the time frames, that is not changing. You will have until August 31st of 2020 to complete the required activity in order to earn the wellness incentive. So the required activities between now and August 31st, you need to complete an online health risk assessment. You also need to complete any age-appropriate physicals or screening, so basically your annual well woman or well man exam, and then you will also need to participate in a screening, a biometric screening. At some point early next year, the city will announce the biometric screening events, and so you'll just need to show up and be screened at one of those events, or take a screening form to your provider. If you're having your labs and those things done with your primary care physician, you'll just take a form to that primary care physician. But those are the only 3 things that you need to do in order to earn the incentive. So complete an HRA, get an age-appropriate wellness exam, and then the third thing is the biometric screening. And if you complete those things by August 31st of next year, you will earn the wellness incentive. This is a change for next year as well. The wellness incentive will be paid in the year earned. So the way it works today, you completed your activity by August 31st of 2019, and then in 2020, you get the reward. Going forward, you complete the activity by August 31st of 2020, and then in December, you receive the reward/incentive, which is a $500 payment. So that $500 payment will be deposited on your December pay stub. And as we get closer, as we get into 2020, we will let you know when exactly to expect that $500 incentive payment. Again, complete the activity by August 31st, you earn the $500. So get it done in 2020, you get the wellness incentive in 2020. If you completed the wellness activity for 2019, there is a bit of change in how you will receive that incentive. So if you completed everything by August 31st of 2019, you were told that you would receive a $300 contribution into your HRA, HSA, and you'd get a per paycheck differential of $10 to offset your medical premiums. So what we are doing differently is you will still get the $300 deposited for wellness in January of 2020 if you completed the activity in August, but that $240 per paycheck differential will now be paid in one lump sum. So in January of 2020, you'll get if you completed the activity, you'll get the $240 on one paycheck, and then we will basically have closed out that 2019 incentive. Everyone with me? So if you did it in August, you're going to get everything in January, and then the slate for 2019 wellness is done. We move forward, but you're still in your new wellness cycle for 2020, and then you need to make sure you complete those 3 things by August 31st of 2020, and then if you do that, you get $500. Okay. So now we'll talk about medical benefits with CIGNA, and then pharmacy with CVS. So before we get into the actual plan designs, let's talk about network options. Those are not changing, but this is just a bit of a refresher for everyone. There are 2 different types of networks offered. So the first network is the Open Access Plus. So the Open Access Plus is CIGNA's broad network. That network is tied to your current HRA plan. So if you're on the HRA plan today, or if you plan to move to the HRA plan for next year, it sits on CIGNA's Open Access network. And as a reminder, there are no out-of-network services covered on any City of Dallas plan offered. The second network offered is the Local Plus network. The Local Plus network is a targeted high-performance network. So it is somewhat smaller than the broad network, but it is made of high-performance, very efficient providers. And the match is roughly about 87% from a PCP standpoint of providers that's in the Open Access network compared to what's in the those in the Local Plus network. The premium copay plan and the high deductible health plan, HSA, both of those plans sit on CIGNA's Local Plus network. So depending on which plan you are electing, please go to CIGNA's website, and don't go to mycigna.com, go to cigna.com. Look at the different providers that you see personally and verify which network they are in as you are making your plan elections for next year. Also, as a reminder, the enhanced benefit tier option, and that just gives you a lower copay, lower co-insurance when you use Baylor or Methodist facilities. That is still in network, and that is still open for you. So just try to see if you're having facility services performed. If you can get those done at a Baylor or a Methodist, your out-of-pocket expenses are less of an amount. Also, with the Local Plus network, because we had several people who reached out to us after the beginning of the year and said, hey, can I switch back? Once, as a reminder, you cannot change plans after the first of the year. So that's why it's extremely important for you to make sure that you are verifying which network your providers are in. But I think you will all be very happy with that Local Plus network. It is, again, a targeted high performance network. Moving into your medical plan options. So the first plan that we'll talk about is the HRA plan. The HRA plan is on CIGNA's Open Access Plus network. The structure of this plan design has not changed. It's a $2,500 individual, $5,000 family deductible. Out-of-pocket maximums are $6,350 for an individual, $1,270 for a family coverage, and again, there are no changes there. This plan covers preventive care services at 100%, as does every single plan offered by the city. This plan has a 25% co-insurance, and co-insurance kicks in once you've satisfied the deductible. To offset those deductible expenses, you pay along with your dollars that you have in the health reimbursement account. And then once you satisfy the deductible, you go to co-insurance, which is 25%. The emergency room has a $350 copay. Remember that that copay is waived if it is indeed an emergency and you are admitted. So if you just remember, you have multiple access points of care outside of the emergency room. I know sometimes when it's after hours, we're trying to figure out where to go, but you have convenience care clinics. You also have urgent care facilities, so there are places to go outside of the emergency room. The other point of note reference on this slide is the City of Dallas HRA contribution. As a reminder, that's changing. So it'll be $200 for an individual and $700 for family. The next plan is the premium copay plan, and this plan has a lot of green on the slide because this is where the city has made a significant number of enhancements to the plan. So first and foremost, you'll notice that that deductible has been reduced. So it's $1,500 for an individual, $3,000 for family. The out-of-pocket maximum is unchanged, and what you'll see is that the out-of-pocket maximum is consistent across all three plans offered by the city. Preventive care also covered at 100%, and then you'll see co-pays for primary care physicians is $25, $50 for a specialist, x-rays and lab work, $25 copay, or a $50 copay, and that'll just depend on the type of diagnostic service that you're having performed. Urgent care, this is a change. It's now $40 on this plan. And then the emergency room copay is $300. Again, also waived if admitted. The co-insurance on the premium copay plan is 20%. So it's about 5% less than what you would pay on the HRA plan. HSA plan. The HSA plan has a $3,000 individual deductible, $6,000 family deductible, the exact same out-of-pocket maximum as all three plans. And the point with the out-of-pocket maximums is you want to make your plan decision based knowing that no matter which plan you're on, your worst case scenario, which is that out-of-pocket maximum, is consistent across all three plans. So as you're making your plan election choice, you want to make your decisions around how often you need to access care, where you access care, and your financial decision. That's kind of what we want you to, those are things that you can use to make your plan design or plans change decision. The HSA plan also covers preventive care services at 100%. And this is the easiest plan to understand because it pays, you pay all the dollars up to the individual deductible amount, and then you go to co-insurance. So it's quite simple to understand. New this year is the increased contribution for the city into this plan. So if I take the HSA, the high deductible health plan with the HSA, the city will give me $700 if I take individual coverage, and then $1,700 if I take family coverage, which is a significant portion of that deductible amount. Now we'll transition into talking about pre-tax savings account. So these are, this next few slides really will talk about plans that are beneficial to you from a tax savings standpoint. The first plan is the health savings account, and again, the health savings account is an individual account that actually you own. So in this account, the dollars you contribute to this account, as does the city, and the dollars are yours once deposited into the account. So it's not the same as your HRA. The health savings account is a qualified, it has to be attached to a qualified health plan, high deductible health plan, which your plan is, and it gives you tax preferences. So basically you put the dollars away on a pre-tax basis. They sit in an interest-bearing account, and then as long as you use those dollars for eligible HSA expenses, there's no tax penalty applied to you. You have to be enrolled in a high deductible health plan in order to take a health savings account. And again, that money that sits in that account is not taxable unless you take it out for a non-qualified expense. And you will also have investment options with the HSA offered by the city. This next slide shows you contribution maximums. So if I look at this slide, it shows that what the IRS, the annual IRS contribution maximum is, and basically the note here, and I'll still walk you through the example, but if the city is contributing dollars, you still cannot exceed the IRS contribution maximum, so you have to subtract what the city's giving you from the maximum contribution amount. So for example, on the employee, if you have employee only coverage, so you're not covering any dependents, the contribution max is $35.50. If the city gives you $700, which they will if you have individual coverage, then your maximum contribution amount is $28.50. So the gist of this slide is to make sure as you are determining how much money you want to put inside for that HSA, you remember that you have to account for the dollars that come from the city. The HSA is actually a great plan for those of us who can get past that high deductible health plan, and putting your dollars into an HSA account will help you prepare to pay the initial deductible, and the city again is contributing to that to help you offset some of those expenses. But a few reminders for you are if you are considering taking this plan. First and foremost, you cannot be double covered, and you definitely cannot have that double coverage on a non-qualified plan. For example, if you are covered on your spouse's plan and your spouse is in a PPO plan, which gives you access to first dollar coverage, well, you're not HSA eligible. Your spouse cannot be enrolled in a FSA as well. It's basically double dipping, right? Because FSA plans and HSA plans, they're all tax savings plans. And the IRS does not allow us to double dip, unfortunately. So we just need to make sure if you're contributing to the HSA, you are an eligible participant. The other thing to remind you of, if you are today participating in an FSA account that the city has, and you know for a fact that you're going to transition to the high deductible health plan, you need to exhaust the balance in your FSA account before the end of the year. So by December 31st, that FSA account balance needs to be zero. If you have $5 or $500 in the account on January 1st, you're not HSA eligible. And you can talk to your enrollment counselors and the benefit specialists about that, and they'll be able to help you talk through the tax consequences there. If you are considering participating in an FSA or the HSA, also remember that those are things you have to re-elect every year, so we're not rolling those contributions over. Now let's transition and talk a little bit about flexible spending accounts. Again, this year, flexible spending accounts will be administered by CIGNA. You have two options for an FSA. The first option is a medical FSA. On a medical FSA, you set aside pre-tax dollars, and you would determine that amount this year, and let's say you decide you want to put in $2,000. The city will make those dollars available to you on January 1st, and then your elected amount will be taken in equal increments from each of your paychecks over the balance of the year, but all the dollars are available to you on day one, so on January 1st. The maximum that you can contribute is $2,700 per year, and the funds don't roll over. These are use it or lose it accounts. The city has a grace period which allows you to spend them down, but they're not technically rolled over. And any dollars that remain in that account at the end of that period are forfeited by the plan, to the plan. The other type of FSA that they have available to you for next year is called a limited purpose FSA. Limited purpose FSAs only allow you to use the dollars in those plans for pharmacy and dental and vision services only. This is for people who may take the high deductible health plan with the HSA. So if I take the high deductible health plan with the HSA, but I know that so I'm not FSA eligible, I'm not medical FSA eligible, then I could take the limited purpose FSA and still put aside some additional dollars to offset my dental and vision expenses. And again, these funds are available to you on day one, but they don't roll over. It works just like the medical FSA, except you only use them for dental and vision expenses. Again, more for those people enrolled in the high deductible health plan with an HSA. Dependent care FSA. Dependent care FSA is dollars that you use for child care, child coverage, or adult care. So if you have maybe aging parents that you are paying for adult daycare for, those are things that you could use your FSA dollars for. This plan has a higher max contribution maximum, it's $5,000, but the other difference between a dependent care FSA and other FSAs is that you have to accrue the dollars in that plan. So for example, if you elect $5,000 for dependent care expenses, those dollars that entire $5,000 amount is not available to you on day one. You have to pay for it through your payroll deductions, and then you build up the balance. You build up the balance in that dependent FSA account, and you can only take out what you've put in. It's kind of like an HSA. Again, funds don't roll over, and I think the change for this year on the dependent care account is that you have to submit for your reimbursements online because there is no dependent FSA card. Okay, so this next slide is posted online, so we won't go through it in a ton of detail, but this is what I would say as you look through all of the materials that the city has posted on their website. This is a great cheat sheet slide. It basically says if I take what medical plan, what IRS tax advantage plan am I available for, what are the contribution limits. So if you follow this slide, it will help you just in knowing what tax advantage plan goes with the HRA, what tax advantage plan is available if I take the high deductible health plan. And let's just use the HRA plan as an example because I want to walk you through it so you kind of know what you're looking through. So in that second column for health reimbursement account clearly means that you're taking the HRA plan. The expenses that you can use the HRA for are medical and pharmacy only. The employer contribution amount, so what the city's contributing, is the $200 or the $700 based on your election. The annual contribution limit is $6,000. And what's the fund availability? So is it available to me on day one, or do I have to is it deposited in different increments? The entire balance on the HRA is available to you on day one. And then unused funds, to the gentleman's question earlier, unused funds in that HRA will continue to roll over. Okay. Pharmacy. So on the pharmacy plan, if we look at all three medical plan options, the HRA plan has absolutely no change to how pharmacy is administered by CVS. Deductible, once your deductible is satisfied on the HRA plan, then it goes into co-insurance, so 10, 25, or 40% based on whether it's generic brand or non-preferred brand. The copay plan is where you have change. On the copay plan, we remove the separate pharmacy deductible and we've added copays. So these are flat copay amounts, $15, $40, or $75. If you are taking a medication that's less than $15, you'll pay the lower cost. So someone asked this in a meeting last week, well, what if I'm on a $4 prescription medication? You still pay, you go to CVS, you pay $4, you will not be asked to pay the $15. And then the HSA works the same. You are responsible for all pharmacy costs until your aggregated deductible is met, and then after that deductible is met, it's 20% co-insurance. 20% co-insurance for each tier of pharmacy benefits.
For the premium copay plan, after the deductible is met, are you responsible for the copay and the co-insurance?
The premium, no. So on the premium copay plan, there is no co-insurance anymore. On pharmacy. No, on medical, yes. So on pharmacy, it's strictly copay only. On medical, it's copay for all office type visit settings. So if I'm in my primary care physician's office, chiropractor's office, dermatologist's office, urgent care office, those are all things that are now copays on that plan. I only go to co-insurance on the copay plan when I have like inpatient services or outpatient surgery. Those are things where I'm going to go into co-insurance. Does that help?
Yes, ma'am.
Perfect. Okay, other notes on the pharmacy program. You still have access to free diabetes and hypertension medications if you are if you take the HRA plan or the premium copay plan. The preventive therapy drug list is also posted, and remember that preventive care drug list gives you access to a lower cost for generic medications depending on the cost of that medication. So if the medication is under $100 and it's on the preventive drug list, then you pay $25 for it. If it is over $100 and it's on the preventive therapy list, you pay only $40 for those medications, as long as they are generic and they are on the preventive therapy list. That list is posted on the city's website. Okay, preventive care. So this slide is simple. Every plan offered by the City of Dallas covers preventive care at 100%. So preventive care are any preventive exams, diagnoses, age-appropriate exams, and it accounts for both you and your dependent children under the plan. And as a reminder, this is a part of how you earn your wellness incentive for next year. So let's just make sure you have those appointments scheduled, and again, they're at no cost to you. CARE ATC. So this is a reminder about the CARE ATC clinics. As you are hopefully all aware, you have access to the clinic, which is at City Hall. If you're on the HRA plan or the premium copay plan, you basically have free office visits, and that's for both sick and preventive care. So you can go there, not pay anything. They also do on-site labs. If you are an HSA participant, you can go there and to the clinic and get your annual well woman or well man exam, and that will be free because it's preventive and allowable under the rules of an HSA. But if you are sick and so you are going in for a sick visitor because you're not feeling well, then that's a $25 cost to those who are on the HSA plan. Once you satisfy your deductible, then that $25 copay is actually just a fee, is reduced for those of you that are on the HSA plan. KANNACT diabetes management. So for those of you who have family members or maybe you yourself are diabetic, just as a reminder, at no cost to you, you have access to a diabetes management program, which is KANNACT. This program will support you for all of your diabetes and hypertension needs for 2020. It is at no cost at all to you, and it's basically management for diabetes and cardiovascular conditions at point of sight. If you're diabetic, it will give you a free glucose monitor. It provides your testing strips and supplies at no cost to you, and you also get a dedicated clinician to support you and your condition. And as a reminder, it's not just for you. So if you've got a spouse that's covered under the plan or dependent children covered under the plan, you can participate in either the diabetes program or the hypertension program. The hypertension program also includes a free blood pressure cuff, so a device to help you with those readings, and it's measured and monitored as well. So they are also here on site. If you have questions about that program or how you sign up, how you get access, make sure to see one of them next door, or you can sign up on the KANNACT website, and all of this information is posted. Wellness centers, reminders about the wellness center. So you've got a location, a gym at City Hall, and you also have a location at the Oak Cliff Municipal Building. The hours for the, I think you guys call it OCMAC, the hours for that particular location is 6 a.m. to 7 p.m. daily. And they have free classes on nutrition and fitness consultation, and I think they even do group classes at your Dallas City Hall location. And you can have the cost for that payroll deducted. And there's no changes to fees there. The benefit reward program, I feel like we've talked about this a lot, so I will just remind you, if you did everything that you were supposed to do by August of 2019, you're going to get a $240 contribution in January, and you'll get the $300 wellness contribution to your HRA HSA account. For 2020, in order to be compliant, you need to complete 3 things by August 31st of 2020, age-appropriate exam, health risk assessment, and a biometric screening. If you get all those things completed by August 31st of next year, you will receive a $500 deposit in December. Active employee contributions. So this looks at your contributions on a per paycheck basis. So again, the HRA and the HSA, there are no changes. So if you're in those plans and you plan to stay in the same plan for next year, those contributions are not changing. The premium copay plan is where there is a change. There's now a tier for those earning under $44,000, between $44,000 and $66,000, and over $66,000. If you earn less than $66,000, you'll notice that that rate is lower than the current rate today. If you earn $66,000 or more, the rate is exactly the same as it is today. Again, rates are posted in the guide. Resources for you for medical and pharmacy, you have the CIGNA app, which is mycigna.com. There is an app for CVS. And there is a Care ATC app. Remember that Care ATC likes for you to schedule appointments. There is a small window that they allow walk-ins, but for the most, they want you to schedule appointments. Now let's look at dental. The dental has absolutely no changes for 2020. There's still 2 plans offered. The first is a dental PPO plan. The plan max is $1,750, and then the deductible is $50 per person on the plan. Preventive screenings are covered at 100%. Basic services, which are things like your fillings and simple extractions, those are covered at 80%, and then major service, which would be root canals, bridges, those things are covered at 50%, and orthodontia is also covered at 50% under the PPO plan. And again, your calendar year maximum is $1,750. The second plan, and that plan has the premium change for 2020, so you definitely want to take a look at those premium changes in the guide. The second plan option is the dental HMO plan, and really that's just a managed care dental plan. It will predominantly include a lot of your what I call chain dental providers. It's managed dental care, so you always have to be assigned to a primary dentist. We ask that you make that designation of the primary dentist when you sign up. There are some of us probably in this room who have signed up for that dental HMO plan and a dental provider has not been selected. This means you are unassigned. So when you go through open enrollment for this year, we will require that you choose a dentist so you can be assigned to a dentist, and then you'll have access to your primary provider on the dental side. Again, it's managed care, and the benefit of this DHMO plan is that it's available to you at a lower cost. But you also have to use network providers. You can change providers within the network, but you always have to use network providers, and there is no plan maximum. So as long as you have your copay amount, then you can continue to have services done. There is a schedule of benefits that's posted on the city's website. So for every single dental procedure that there is a schedule of copays that you can find on the city's website to help you know exactly what your cost is if you are considering taking the DHMO plan. And again, the DHMO will have a lower premium cost to you. Next, we'll transition to vision. The service provider for vision is Davis Vision. This is a very rich plan. The dental plan gives you free frames at any Vision Works. You get an eye exam for a $10 copay. You have a $140 frame allowance, and you can select a frame that's more than $140. The balance of that amount is what you're responsible for. But in most cases, they'll give you like 20% off of the additional, so you'll still get some sort of discount. Single vision lenses, bifocals, and trifocal lenses are all covered in full. You also have a contact lens allowance of up to $130, and then if you go over that $130 benefit amount, you get an additional 15% discount. The frequency, we've had a little bit of a change here. So you get an exam once every 12 months, and then you have access to contact lenses or frames every 12 months. In the current year, it is, let's say I had my vision, I purchased glasses in September of 2019. The way the plan works is that my next set of glasses or contacts would not become available to me until October, right? Because I have to get past the 12 months. So one of the changes that the city made for this upcoming year, it's now a calendar year benefit. So regardless of when you went. So for example, if you go this week, so you go in September, on January 1st, that benefit will reset. So now you don't have to look, we think that, thank you, we're glad. We think that that's beneficial because now you don't have to remember what month you got your vision exam, and you're not waiting for the provider to call you and say, oh, it's time, or you call the provider and they tell you it's not time. So just know that that'll reset, and then that will be the way the benefit works going forward. It's a calendar year for your hardware, so lenses or contacts. These are the rates. The DHMO rates stayed exactly the same. The vision rates stayed exactly the same, but the dental PPO rates increased slightly. So watch those, the changes in the rates, because this is the one place where you actually had a rate increase, so you just want to make sure you pay attention to that.
So you're saying that we already used that allowance recently, once January comes, we get it all over again?
Everything except ortho, yes. Yes. So his question is, let's say I exhausted my $1,750 last month because I got a bridge put in. What happens in January? I have a new benefit amount. Except for ortho, because ortho is a lifetime maximum. So it's a calendar year maximum for all dental services with the exception of ortho. All right, so let's talk about life and AD&D. The provider for all of your life insurance coverage offered by the city is the standard. Basic life insurance for a full-time employee is a $50,000 benefit amount. If you are a part-time employee, you can purchase the basic life insurance amount. You can also purchase additional, what we call supplemental life insurance for yourself and your dependents. If you are an employee, you can purchase that in increments of your annual salary, and the max that you can purchase is $500,000. On your spouse, you have an option of purchasing either $15,000 or $25,000. And then if you have child coverage, you have two options as well. Those options are $5,000 or $10,000. The reminder on the slide is what you probably see from us every year. It reminds you to update your beneficiary information. In the event of someone passing away, we want to make sure that that benefit goes to the person or persons that you intended it to go to, or the persons that you would like it to go to. And the only way for us to ensure that that happens is if you update the beneficiary information. This slide looks at voluntary AD&D, which is accidental death and dismemberment. So first and foremost, you have to purchase life insurance in order to buy the accidental death and dismemberment. You can buy that, buy the coverage in increments of $25,000 up to $250,000. There's no evidence of insurability because it's accidental death coverage. You can purchase it on your spouse at the amount of 60% of whatever you purchase on yourself, and 20% for your child or your children. And again, no evidence of insurability required for this, and it just pays in the event of accidental death or some sort of dismemberment. And the same rules apply there. Update the beneficiary information, because you can have one beneficiary for your accidental portion and then another beneficiary for supplemental. So just make sure it's all updated. Now we're going to transition to the voluntary plans. So if I look at the voluntary benefits at the beginning of the presentation, I told you that all of those coverages transition to the standard. And so this is your opportunity to enroll. It is a true open enrollment period. So whether you had coverage or not, so if you didn't have critical illness before, you can take it during this enrollment period. It's a true open enrollment. The current plans that you have today, so if you have Aflac, Allstate, or Abacus, those coverages will no longer be payroll deducted after December. So you have to sign up for new benefits. I will walk through them just briefly here just so that you know a little bit about what they are and how they work. So accident insurance, basically, it's pretty straightforward. It pays you in the event that you have an accident, some sort of accident. As a reminder, all of these policies or coverages that we're talking through, they all pay you directly. This is not insurance that's paid to a medical carrier or to a hospital. These dollars are paid directly to you. They're not offset by what the plan pays. It's a payment directly to you. Critical illness, I think the most important note for you on the critical illness piece is that today, some of you may have a separate cancer policy and a separate critical illness policy with Aflac. Under the standard, you will have no need to have two policies. The standard's critical illness policy will cover you for cancer as well. And then the hospital indemnity policy. The hospital indemnity policy pays you in the event that you are hospitalized. And again, it's a flat benefit amount and it's paid directly to you. So the doctors don't get paid. It's not the doctor's money. It's not the nurse's money. It is your money, and it's to you to help you offset expenses that you're not working. You're obviously hospitalized. So it's just kind of dollars back in your pocket. You will also have the ability to purchase short-term and long-term disability. Short-term disability pays you if you are out of work and you cannot work for a period of up to 6 months, then that's short-term. If you have a disability that prevents you from working longer than 6 months, that's when long-term disability would kick in. Both of those benefits are 60% income replacement options. The next slide is on the Employee Assistance Program. So the Employee Assistance Program is probably one of the most underutilized benefits offered. As a reminder, you do not pay for this coverage. The provider is CIGNA, and it is paid for by the City of Dallas. So you can use your Employee Assistance Program if you would like to talk to someone maybe about managing stress or relationship difficulties, work difficulties, pretty much any issue that you have, you can use the EAP as a resource. You also have access to face-to-face visits, and those face-to-face visits are per incident. So if you are having an issue with the spouse and you use your EAP benefits, but then maybe 2 months later there's an issue with work, you can still use the EAP. It's not, you don't ever feel like you've used it up or you've exhausted the benefit. The benefit is available to you always. It's also available to you and your family members. So just make sure, especially if you've got adolescents or teens, you've got someone who maybe they don't want to talk to you, give them the phone number to the EAP and just, allow them to know that there's a resource out there for them. So what do we need from you? We need you to review all of your enrollment materials. There are a number of changes this year, and I know we went through the majority of them, but spend a little bit of time reviewing that guide and make sure you figure out which plan or plans will make the best fit for you or the best fit for you and your family. And then please do not let this deadline of October 4th pass you. It is not a moving target. On the 4th, it closes. So it is important that if you want to have City of Dallas benefits in 2020, that you meet with a benefit counselor or you call the phone number or you go online. The city's giving you 3 opportunities to enroll in benefits for 2020. So let's just make sure that we try to get those things completed by October 4th because we want you all to have benefits next year. If you have questions, that's what the phone number is for. So use EBC to support you with the counselors. They are very well educated on every benefit that the city offers, and they can answer any questions that you have. If you have a general question or a payroll question, or you want to know about your PTO time or something's not right on your check, you still use the Benefit Service Center for those types of things. So you want to call the Benefit Service Center at the number listed here, which is also in your guide. During open enrollment, the Benefit Service Center will have extended hours, so just know that they'll be there 2 days a week, it's Mondays and Wednesdays until 7. So you can always use the Benefit Service Center if it is a current issue or a current 2019 benefit issue or a payroll issue. But if you have questions about 2020 benefits, let's use the EBC phone number, website, and the benefit specialist to support you there.